Welcome to this Voices from the Field interview series. Today, I'm speaking with Daragh Connolly, who is a pharmacist in Ireland. And we look forward to hearing about his experience through the pandemic and some tips that he has for both health professionals and the public going forward. Welcome, Daragh. Lovely to have you here today. Thank you for joining me pretty early on your day.
It's my pleasure to be your guest.
So
it's my pleasure.
I understand that you come from a family of pharmacists. So did you always plan to be a pharmacist? How did that come about?
Probably like lots of teenagers, I wasn't very sure what I wanted to do for a job, but I certainly knew that I had a huge interest in science and particularly around chemistry. And I wasn't quite sure where that might lead me. So I did some undergraduate study in a general science degree. And then eventually the penny dropped that all of those things that I wanted to achieve by studying chemistry, that if I were to transfer over to a pharmacy course, that if pharmacist wasn't what I wanted to be in the traditional sense of the role, I always knew that I could use that love of chemistry that I had for other things. When I transferred over, I very quickly realized that there are huge amounts of career opportunities available to people with pharmacy degrees that just wouldn't be what most people's interaction with the pharmacist is, which is a community pharmacist. So then, having a family background, my grandmother was one of the first handful of women to become a pharmacist in the new Irish Free State in 1925, and my dad and several uncles are pharmacists as well. I kind of had to step back, maybe as you do in your early 20s, and say, maybe they're not so bad, maybe that's not such a bad way to make a living. So it's a choice then that I made, and that was 25 years ago, and I absolutely haven't looked back. I am very proud to be a community pharmacist, and it's a job I really enjoy. So I'm delighted to share any experiences I have with you today.
Great, thanks, Daragh. So can you describe a little bit what your work environment is? What is your day-to-day work as a community pharmacist in Ireland?
I think the role of the community pharmacist in Ireland is like it is probably, in all four corners of the globe. I have been very lucky to have had the ability to lead the team that did the vision for community pharmacy for FIP 2025. And we really hit on a very good idea for the front cover of that document. And it just showed pictures of community pharmacists outside their shop fronts all around the world. And what we were able to drill into is that community pharmacists are at the heart of their community, and that their door is always open. And what gives me great pride is the accessibility that people have to community pharmacy is second to none. You cannot get more access to a healthcare professional than you can to a community pharmacist 6-7 days a week. And what really became apparent through the COVID pandemic was that became even more evident and more crucial to the role that we play in delivering first-class healthcare to the communities that we serve. And Helen, the other thing that became really, really apparent as well was through COVID, these were uncharted territories for everybody, whether they be healthcare professionals, whether they be legislators, whether it be government officials, as to how we deal and help ourselves get through as a society through COVID. What was brilliant about being a community pharmacist in that is the trust that we have built up with those communities who know us and rely on our expertise really, really came to the fore, because people needed to get information, and at a time when information was so hard to come by, from trusted professionals. So the elevation of that role, probably what people understood that they could get from their community pharmacist, really then moved up to another level. So even as an example of that, in the last year, there has been a survey done of the trust levels that people have in the Republic of Ireland of professionals that they deal with. And pharmacists have scored the highest of that. So pharmacists have a 97% trust rating from Irish people. And I think maybe if we had looked at that survey, if it had been done 3-4 years ago, I would reckon that pharmacists would have been very high. We would have been up in the 80s. But I think the interaction that we've had, because of our accessibility and because people know and trust us, that has elevated even more. So that's been a very positive experience, which has come from the relationship that we have grown and built over generations in community pharmacy in Ireland, and it's done a hell of a lot of good.
So Daragh, you're such a passionate, I can tell, a passionate professional, and obviously, as you talked about, a trusted professional in the community. But COVID was challenging, and you were really on the front line being a pharmacist. As you said, you had a lot of contact with people. Information was difficult to come by, especially trusted information. What was the biggest challenge that you faced during that first wave of COVID?
The biggest challenge that we faced was our own personal safety. Because we were driven by wanting to provide that healthcare service, to keep our doors open, to keep people safe and well by getting them their medicines and getting them the information that they needed, we wanted to keep our doors open. And we knew that the healthcare system in Ireland would collapse if community pharmacies couldn't stay open, because the GP surgeries had closed and GPs were not seeing people. They only were offering remote access to people, which you and I are very good at talking to people through telephones or video calls like this. But that really isn't the most vulnerable people in society's way of being able to access information or being able to have reassurance. So the biggest worry, Helen, that we had at the time was, personally, I was so worried that not so much for me, but if I brought COVID home and infected my parents, or who are in their 80s, or my children, or my wife, or my broader family, or that if any of my staff had got COVID, a COVID infection by doing their job. So it was a nervous time, but what I will say is, as far as the public recommendations as to how we go about our social distancing, wearing masks, washing hands, people were brilliant at it. And maybe it's a little bit different because I'm not in a metropolitan area. It's a thriving provincial town, but kind of everybody knows everybody. And there was real social cohesion and a social solidarity around people doing those things to keep each other safe. And because of that gave us a little bit more confidence as time went on. And then as the recommendations came out, say, about putting up split screens and the through flow through the pharmacy, and that we felt a lot safer and we could start to see that those public health measures were working. But really, it was a very, very scary time for us because there was so little known about the disease and we could see how quickly it was spreading. But we were also, that was balanced with the feeling of great pride that we were able to work hard together as a team, that we were able to deliver that healthcare. And there was a huge appreciation that came to us from the people that we serve as well. So we really felt a huge sense of social solidarity with it.
Yeah, that's good to hear. I imagine it wasn't the same in every country and for every health professional in the world, that they had this feeling of solidarity and appreciation. We hear about violence against health professionals, really difficult situations to live through. So it's good to hear that you, in your community at least, you were well looked after in a way. Were there other things that you put in place with your team or, from the regulators, etc., that helped you get through this really difficult time?
What we did as a team was we looked at, we kind of came back and had a little bit of a helicopter view, and it was kind of once in a generational kind of a thing, Helen, that we had to say, what is it we do that's really, really important? What is our absolute core function, and how do we deliver most back into our communities? And the core function of making sure that the right medicine gets to the right person at the right time is what we focused on. And what we were able to do then is to see, look, what is ancillary to that, and how is it that we can best perform in that environment? So we run a typical, pharmacy here in Ireland. We work 6 days a week, 9 to 6. We work through lunch and we rotate our staff. So the very first thing that we did is how can we give the best of ourselves? So we very quickly saw that we didn't need to have a full retinue of staff every day, and the pharmacy did not need to be open for that core function to be open 9 hours a day. So we brought our working day down to 6 hours, and we closed for a decent break at lunchtime, and we gave ourselves an hour's lunch. And we all went out for a walk in different directions and got great fresh air and used that for the headspace that was there as well. And because we were able to do that, people fully realized that the pharmacy was opening different hours, and they themselves realized that they just couldn't rock up and that we would be there at 1 o'clock because that's when they were having their lunch. So by having that review to see what our core function was, we were able to zone in on that. And then as restrictions lifted, we were able then to do more of the ancillary stuff. I think the other thing to bear in mind as well, as healthcare professionals, we have our own vision of who we are. We also have a realization of our own skill set and what we can do for people. But the majority of people who walk into a community pharmacy, and I'm going to say 97% here, they're not sick. They don't consider themselves to be sick. So they consider that you only need something like that if you're sick. The conversation that we would have with them that we're keeping them well, it's kind of a different conversation. So their own perception of what we do changed within that because they realized that we had to zone in on that core. The other thing that we were able to do by not having that throughput of people coming through the pharmacy, we were able to have our own conversations more easily about what it was like, the conversation you had at dinner last night with your family, what COVID meant to your family, what your job meant to your family. And one of the things that came through for us was, as people in the team brought in their experiences, we were very happy to share with each other that we felt that we were the lucky ones because we were going to work, that we were doing something that was contributing to beating COVID and to keeping everything functioning. So we took a huge amount of pride in that as well. And it really strengthened us as a team because we were able to zone in and look at that. What is it that we do and what is our purpose? Because you can be very aware of what your purpose is, but it's not every time that you hit your straps and say, yeah, nailed it, nailed it, nailed it. We hit the bullseye there. So as far as a team was concerned, we were able to have much more conversations because we had stepped back. What is that we are doing? And now we're able to say, now let's go and do it.
Brilliant. It sounds like you were able to keep a cool head and help lead your team forward. Very much remembering that all health professionals are humans. And I love that you demonstrated healthy living and by reducing your hours, by getting out and getting fresh air. So you became champions of, looking after yourselves as well. And as we know, as health professionals, you need to look after yourself first. It's like when we used to get on airplanes and they used to do the drill and you had to put on your own oxygen mask before helping others. I think that's exactly the same sort of idea that you thought, what do we need to do? Absolutely. And how do we do that best to serve our clients? And then definitely looking after ourselves and our team. So I love that you communicated between the team and you had those feedback loops to make sure that people were connected and constantly learning and had the support they needed. So you talk a lot about teamwork, and I understand that you also like to mentor younger pharmacists. What have you been telling the younger, less experienced pharmacists during this time? What has been the key message for them?
The key message that I have made with them is the here and now, which is to say, and it was very apparent to them, and I didn't really labor the point too much, was that you're part of a team, and if we all look after each other as a team, we function best as a team. So as the community pharmacist, and particularly as a young community pharmacist, you find yourself in a leadership role where everybody's asking you a question and you have to have an answer. Probably it could be at the age of 22 or 23. There are very few other professions, Helen, that I can think of where you find yourself in a leadership role like that at such a young age. So the advice that I gave my student pharmacists at the time was that you must look to see that you are looking after everybody in the team, that their wants and needs, that you can fulfill them and get the right people doing the right jobs so that they can fulfill their purpose and do their best to help you. The thing that made most sense to the pharmacists to my student pharmacists at the time was that was able to be done by an accelerated vision of what the role of the community pharmacist is. So to give a little bit of context to the work that we were doing. So it's inevitable and it's proper that during a conversation like this, you have to say, what is it that is out there that's stopping you being the best community pharmacist that you can be? So if we look at the team and how we organize ourselves in the team, that's great. But the outside factors that stop us being the best community pharmacist that we can be can often be around the idea of how we interact, not so much with our patients and clientele, it's actually with other healthcare professionals and the regulatory structures that we find ourselves working in. So I'm sure this probably happened in lots of jurisdictions around the world. We were given much, much greater professional autonomy as community pharmacists as far as prescribing of medicines was concerned, repeating medicines, and also the ability that we've always wanted to have, which is to have a greater role in problem solving, particularly where you see the interface between the levels of care. So there's nobody listening to this who's a community pharmacist who doesn't understand that some of our biggest frustrations come from people moving from levels of care, particularly from secondary care back to primary care, and then how we interact with our colleagues in general practice, and also how we interact with our colleagues who are working in secondary care and getting people home. What was great for the student pharmacist that I had at the time was that I could paint a vision to her and say the things that I've been banging the table about that we need to be able to do our best work as community pharmacists, we now have that professional autonomy to be able to do it. So in a scenario where you may have predicted, Helen, that we were going to have to work under more regulatory burden to actually feel that we couldn't do our job properly, a lot of those regulatory shackles were unburdened from us. So we've actually been working much, much better with our colleagues in general practice and also with colleagues in secondary care, but also doing our best work as problem solvers to make sure that the right medicine gets to the right person at the right time. So in a scenario of what was great adversity, there has now been a fantastic outcome of that. And one of the things that was really, really important to relay is that when we see conflicted communication, it's usually because of the framework in which we need to communicate and our own ability to problem solve. One of the biggest outcomes in the Republic of Ireland from the reworking of the legislation is we had accelerated into electronic prescribing. So what was now happening was that the pharmacy was getting the prescription before the patient arrived. The GP workload had changed, that necessarily as the prescription was being written, the patient wasn't sat in front of the GP. So if you could imagine, I knew 3 hours in advance of the patient coming that this was the prescription. If I had any issue with that prescription or I felt something needed to be done or the patient this or whatever, my line of communication to the prescriber was much, much easier because I could just simply write an email and the email would go. And I would understand that I'm writing that email in a scenario where I have the time to write it and the patient isn't looking at me. And also, when the prescriber got my email, the patient wasn't looking at them, or worse again, another patient. And why is this guy ringing me? What did I do wrong? That has moved the level of interaction and collegiality that we have in primary care onto another level, and the outcome for it is absolutely fantastic. The other thing that has come from it as well is there is a much greater understanding within that collegial loop of what each of us does and maybe what our own issues are in the job that we do, which is probably a little bit reflective of those conversations that we had in a team here in my own practice as well. So I would say in 25 years, the relationship that we have, the collegiate relationship that we have, in primary care with the other caregivers has never been better. It really has been a very positive outcome to a very bleak scenario that is COVID.
Well, it's good that there were some positives, and you were able to paint quite a few positive outcomes from this really difficult situation that we've all been in and continue to be in. But what do you think about the future moving forward? How much of this collegiality will you have? How much of the professional autonomy, this problem solving, and the ability to continue in this quite a positive way? Do you think that's going to continue also with the telehealth, the electronic prescribing, etc.? Do you think all of these elements are going to continue and maybe even improve even more? Or do you think we're going to go back a step to the way things were done before?
You know, I think it's impossible to go back to the way things were done before. I mean, certainly, what you've got to say is it's really important that we don't close ourselves off into a little bubble where we only think in terms of we are healthcare professionals and we know best. What I would like to think is that I would pose that question differently. Would you ask any patient who comes to my pharmacy, would they prefer to have to go to the GP to pick up a piece of paper in the same way that Cleopatra did 3,000 years ago, and then have to physically walk across the street to a community pharmacist who doesn't know what's on that piece of paper and only knows when you put it in under their nose, to be able to be told, I don't know when I'm going to be able to get this for you because I didn't know what was on the piece of paper. If you then paint that scenario and what we need to do is we need to be relevant to the people that we serve. So if you gave that choice to the people that I serve and say to them, do you want us to go back to that system or do you want to stay with the system that we have? It's inevitable. So it's really important, because I think I'm really important because I'm a community pharmacist, to realize that I am important, but I'm not that important. The important people are the people that we deliver the service to. If you bring that on to another level and then you say to yourselves, again, taking community pharmacists out of this, if you went to general practitioners and you said to general practitioners, you must now go back to a paper-based model where you must sign it with a ballpoint pen to make sure that that's a legal prescription. Do you want to go back to that system? Or do you think that you can better manage your workload and be a better general practitioner by staying with the system that we have? So I think that the answer is very, very evident. And I would, with fingers crossed, say that I see that there's no going back. And in fact, Helen, I'd probably go further to say is it's incumbent on us to use that collegiality and to express to our own patients that we mustn't let that happen. And the best way to make sure that that doesn't happen is to build on the progress that has been made and is evidenced to say that we need to go further. So we need to harness that telemedicine or telepharmacy, whatever you want to call it, to be able to deliver more, because the shock to the system that is unable to change, we can't let that opportunity pass us by. Because I was going to say it's once in a generation, but it's not really. It's kind of once in a century, isn't it?
Yeah, absolutely. And let's not take steps backwards when we've moved so far forward. Daragh, thank you so much. I think you've given so many tips and so much insight into what you've been doing and what's worked really well for you. Do you have any messages either for the general public or for other health professionals, whether they're pharmacists or other healthcare givers, in the next few months in this new world that hopefully will be emerging soon, and this positive approach to continuing to do your work?
What I would love to share with people, Helen, is I thought I knew my team really well before COVID, but I now know I know them a hell of a lot better. One of the traps, and I put my hand up to it as well, that lots and lots of pharmacists, not just community pharmacists, fall into, is that they feel they have to do everything. And I think we're notoriously bad at delegation. And by turning around to everybody in the whole COVID thing, where we had to say, look, what is it that you actually do? And what is it that we can do better? What is our core function? We all had to step back and say, what is our core function? Or where can I step up to do more? So I became a much, much better delegator. And I listened to my team And I probably, if you'd have asked me 3 years ago, was I listening to my team? I went, of course I listened to my team. But I really did listen to my team, and I understood what more that they could do. I trusted them more, and I gave them the professional autonomy that I've always been the one saying that pharmacists should have more professional autonomy, because I needed to create the space in my own head, but also in my own professional working, to do the stuff that I've always been saying pharmacists should do, which is spending more time with patients. If I didn't delegate that, I'd be in the background chasing prescriptions, tracing orders, doing all this stuff, quite frankly, that my team are much better at doing than I am. Because when I'm doing that, I'm thinking about something else. So the big message that I would love to get across to people is that please trust your team, please train your team, please listen to your team, and make sure that everybody is doing their best and that you're challenging them all the time to add more value into your team. And the learning from that is, I'm a happier pharmacist because of that, but also the people that I work with thrive on the professionalism and thrive on the challenge to be able to see that they're trusted to do their job and that they're going to be challenged and that we can all get on better if we do that. One of the things that is really, really evident, it doesn't matter where you go, if you can walk into a place and you can sense an atmosphere, you can sense a happy team, you can sense an unhappy team, you can sense a stressed team, you can stress a team that's in flow and it's just getting everything done. You're going to do a better job if you have a better team, and the patient reaction, the clientele reaction to a strong team always then creates a much more positive feedback because they know you're on your game. And the other thing as well is, and I'll leave you with this, is we had a no-nonsense attitude to people who were giving us nonsense the other side of the counter. Because probably, and I know this talking to other pharmacists as well, if there is only so much that you can do for some people, and you can be polite and professional with them, but you can't let them form a queue at the counter because you can't help them. And maybe come back another day, maybe we can help you through a telephone call later on. But that also stripped out a little air, and it wasn't a whole lot of people, look, let's be frank, but it was something that we were very conscious of, that we had a no-nonsense attitude.
Brilliant. There's so many tips there. And I love that you come back to, thinking about your core function, which is getting the right medication to the right people. And that's the core of what you do. And if you're happy and your team is happy and efficient in that and feeling autonomous and professional, then that's what you will deliver. And the patients and the clients definitely feel that. Well, thank you so much, Daragh, for your time today. I really enjoyed our conversation, and we look forward to maybe catching up in a few months' time and seeing how you're doing.
Yeah, I'd love that.
Good. I'll let you get on with your day in the pharmacy now.
Thank you very much.